Hey guys, thank you for joining us. My name is Sergio. We're going to talking about myPAbox, a live webinar, and how to increase your chances of getting into PA school by using myPAbox. Um, so pretty much we're just going to wait for a couple of people to join and then we'll get started. But for a lot of you people that don't know, thank you for joining us. Sorry. My name is Sergio. So for a lot of people that don't know, my name is Sergio. I'm a PA. I've been a PA for about 7 years. I'm also the preceptor of the York PA program and founder of myPAbox. My partner and I, Jacob, he's a PA as well. He's going to be joining us shortly. We created this platform for pre-PA students to help them organize and really increase their chances of getting accepted to PA school. So we're going to be talking about that and doing a Q&A afterwards to answer any pre-PA questions that you guys might have. So I think, how many people are in? I think Jacob's going to be joining us soon, so he's right here. Hello, Jacob. We're just waiting about 10, 15. We're waiting about like a couple of minutes for so that people join. So where are you guys all from? How many people are? 14. All right, so you want to start?
You can
Okay.
give it like 2 minutes
All right.
because more people are joining.
Yeah. Have any of you guys already used myPAbox? Are you guys current users? We definitely want to know because we're going to do a quick overview as well because we realize a lot of even our users weren't properly utilizing the tool the way that we intended to, for them to use it. So we're going to be going over that and hopefully get you guys on the right track. Let me know if there's any questions.
So far, no.
Okay.
So far, no. So I'll give it one more minute and we'll start. By the way, I don't know if he spoke about it or not, but if there are any NBA fans out there, our condolences obviously to the Bryant family. I was a huge fan growing up, so I don't know if the viewers right now are also fans of Kobe Bryant, but the whole situation is. I actually wanted to cancel this webinar because I don't know, shocked all day in disbelief, but we're here, so.
Okay. All right, guys. So basically, we're gonna get started. First thing is what we would recommend. First thing you have to decide if you're going to PA school is which schools you're applying to. That's the number one thing that where you should be starting off because that is going to determine as far as how many healthcare hours you need, how many PA shadowing hours you need, whether you do need them or not, whether you should take the GRE, whether you should be taking the PCAT or the CASPER. So first step is figure out which schools you're applying to. Once you guys figure that out, the next step is to start getting organized to see what the requirements are because this is really applying to PA school is a little bit different than applying to medical school. Every school has a different criteria. They have a different number of prerequisites they need. They have different healthcare hours. Certain exams that you have to take, like the PCAT. Some schools are requiring. They're going to be requiring for the next upcoming cycle. So that's the first thing. Over here in myPAbox, we'll kind of show you guys. This is the list of all the PA schools. Now you could search for a particular school in here. So say if I wanted to search for Hofstra University, or you could just kind of view all the 281 schools that we have here. So say if you click on Hofstra, you'll see a couple of highlights over here. You'll be able to call, email, get the address of the program, because sometimes you have to send supplemental applications. You have to, know the address if there's open houses, things like that, and as well as the website of the program. Obviously, over here, Jacob and I, we try our best to make sure everything is updated, but we want you guys to be our eyes and ears as well. And, don't take our word for it. We obviously try to make the platform as reliable as we can. But if you see an error or you see something that's missing, like for example, somebody emailed us a couple of weeks ago that a certain school changed their accreditation status, and Jacob verified that from the website, and we quickly updated it. If you guys do notice an error in any of the data, click on this report button, shoot us an email, let us know if there's any, and we'll verify it for you, and we'll update the platform literally within minutes. So we have some basic information regarding the school once you click on it. If you're new to this thing and you don't know anything about, you know, accreditation status, about the PANCE rate, we have info icons here that kind of give you a little blurb with links, to the appropriate websites, as well as, anything that you need to know more. A lot of this information is found on the school's websites, but once you'll see, it's very hard to navigate through each school. So for example, if you click on Hofstra University, in order for you to get the same information, you have to go search the website, click on multiple links, and go, keep track of it in an Excel sheet or in a Word document, however you're keeping track of it. Now you'll see on myPAbox, we've organized everything you really need to know regarding the program. You have the program details, if they have certain, as far as the deadline, what the CASPA different deadlines mean. So if you click on this, you'll kind of get a little blurb on that. And again, links to it as well. And then you have the admission requirements. So for example, for Hofstra, the minimum GPA is a 3.2. Prerequisites, so what courses you need, how many credits, with or without lab if the school has it listed, as well as optional courses. Sometimes the school will require for you to take one or the other, as well as any course category. So if there's upper level biology, and then you could view the courses and see here what is considered upper level bio. So this really helps guide you and keeps everything organized, and you don't have to go searching on the school's website and do this on your own. We already did the hard work for you. If there's any certain conditions, like time frame conditions, for example, for Hofstra, these courses need to be within 5 years. Pending prerequisite conditions, certain schools will allow you to have your prerequisites in progress when you're applying. Certain schools will not. They will tell you that you need to complete them. So this really, guys, that's why when we started off, where knowing which schools you're applying to is the number one key. That's going to determine when you can apply. If your prerequisites could be in progress, if they could not. All this information is very important for you to kind of build a good outline of how you should be approaching this. So let's go down to healthcare hours. Now, certain schools will require them, other schools will recommend them. Obviously, in order to make yourself a better applicant, even all the ones that are recommended, we advise you guys to, complete that. Because again, it's very competitive. You want to stand out as much as you can. Over here in the info icons, we have the different patient care experience, what they mean and what type, you could be getting, what the school accepts. We have the PA shadowing. Now over here, they recommend it, but they don't require it. So if you're having a hard time shadowing a PA and you're applying to Hofstra, again, someone that's shadowed a PA might look a little bit better on the application than you. Obviously, still try to get, but you could still apply and your application will not be rejected from a school that requires it. They will still look at your application. So all these things are very important when you're going through the process. Now, evaluations, there are certain schools that, and we'll go through another school as well so you guys could kind of see, what another school's information looks like. This one, it could be from anyone. There's no specific evaluators. GRE is not required for Hofstra. And if you're international students, there are certain exams that you might have to take. And if there's any minimum scores, we have that listed as well. Now, the pre-PA club, now certain schools have pre-PA curriculum. That means you can go in undergrad, in freshman year, for example, and apply to their program, and they can give you, what is it called, Jacob?
Framework.
Yeah, give you a framework as far as, what classes you should be taking to get into their PA program and, kind of guide you a little bit better. So if you're a freshman starting out, again, doing your research and figuring out which PA schools have this is very important as well. Also, we're going to have pre-PA club information as well in here. Now, another thing to look out for, which you'll see, I believe it is in Still University, we do have average GPAs that are, if it's listed by the program, in our platform. So now you see over here, a minimum GPA that's required for Still University is a 3.0. But what they're accepting is really a 3.5 and a 3.4. Now, this should be your target goal. Applying with a bare minimum, just because you meet the minimum requirement, I feel like that's the reason why a lot of people get rejected, because they apply to schools without looking at this factor right here. This is a very important factor whether you're going to get accepted or not. Same thing with the healthcare hours. Now they require 1,000 and 100 community service hours. So there's certain conditions that where for ATSTIL, if you don't have 100 hours of community service, you're not going to get accepted. And this is not something that you want to miss out on 2-3 months before applying, because it takes time to get all these things, the PA shadowing, community service hours. There are certain schools, for example, that require CPR and BLS and other criteria like that before you even apply. So knowing these things are very important, guys, and I cannot stress the fact that make sure the first step in this process is to know, or at least have a general idea of which schools you're applying to. Um, so we're going to go through the questions. If there are any towards the end, we're just going to run through the platform real quick. Now, this is a school match feature. Now, over here is really where it's going to be the most powerful tool. So, for example, if I want to apply to California, Florida, you see the number changing up here. Once you put in the states that you're considering applying to, you put in your GPA, say if I had a 3.2 and 3.5. So it still stays at 35. So that means that's, this GPA is, I'm meeting at least the minimum requirement. Say if I had 30,000 hours. So say if I was having a hard time shadowing a PA, which we get a lot of, if you turn that off, you're limiting yourself to 14 schools. So you still, don't let this, obviously, again, we would recommend that you do shadow a PA. It's good to get exposure into the field. But even with me, like I didn't get to have that much experience with shadowing a PA. I think I did 10 or 15 hours because it wasn't recommended by Toro at that time. And just because I didn't shadow a PA didn't, deter me or didn't make me less of a PA. I've been practicing for 7 years, but the schools want you to get that exposure. So I think, sometimes having this criteria, in my opinion, it really doesn't make you a better or worse applicant. They really should remove it, but it is what it is. So next thing is the GRE. Say if you don't want to take the GRE, you're limiting yourself to 15 schools based on the criteria you have. So it might be a good idea, if you want to take the GRE, it just opens up more schools for you to apply to. Now, the next thing is the tuition, which again, Jacob did a live on that. We spoke a lot about that. I precept the York PA program, which the tuition is very low. I went to Toro College myself, which the tuition was really high. And honestly, it was an amazing school, but I'm still paying off those student loans. So this is a very important factor as far as, knowing that once you get done with PA school, you're going to have to be paying this loan back. So if I do,
it's not
exactly. If you do less than 50,000, unfortunately, there's only one school that matches in that criteria you picked. Majority of the schools are in the 50 to 100,000 range, and in the 100 to 150. So say if we leave this off, we're still at 35, and you could also change the accreditation status to continued, provisional, and we have the info icons as far as what these accreditation statuses mean. And we'll be doing posts and a live on the accreditation status as well later on. Now, if you click on the schools, you have a list of all the schools you match with. Now, out of these 35, you do the same thing. You click on it, you get the basic information, and I'll kind of show you guys. Let me do a school that I haven't saved. Now, once you figure out what schools you match with, next thing you want to do is save the school to your dashboard. When you get to your dashboard, you have this section right here. You have your grades, your shadowing, healthcare, evaluation, and exams. Once you click on Saved School, you'll see the layout is a little bit different. So now you still have your program information, which we showed you on the other page. And now everything is broken down into required and recommended tasks, which is very important. So now you'll see here, bachelor degree is required, GPA. Now over here, they take the CASPA GPA, they calculate the CASPA GPA. We have an info icon as far as how that's calculated. You could click on the formula, but we have a tool that does our algorithm does this for you. Again, saving you a lot of time, and there's no surprises later on. Now you can check over here and you can see as far as what your CASPA GPA is. So this is very important. We're doing this automatically for you. Over here, you go down to prerequisites. Sorry, let me just close some of these tabs. Now it automatically tells you what courses are pending and what you've completed. And once we go to the grade section, we'll kind of see of how this is doing. Say for example, Bio 1. Let me show you guys that actually now while we're at it. Once you go to your grade section, this is your college GPA that we're calculating, and this is your CASPA GPA. You add in your college, once you put your college in, you could add your semesters in. Now, if you have any semesters in progress, you could leave them in progress and you could add a course. So we'll do over here. So let's select biology, bio 1, say if it was 4 credits, it was wood lab. And the other thing to point out on this screen, if you don't see a course, same thing, send us an email and we will add it into the database and you'll be able to add it. So once you go to add course, say if you're taking it this semester, right? And once you complete the semester, you can change the status of your semester to in progress to completed. Once you mark it as completed, it will tell you the grade. Now, say for example, I put A plus. Leave blank if the lab grade was already included, or if the lab was separate, you could put a separate grade in because that's calculated as well. Now, say if I got an A plus in bio, let's go back to York, and you guys saw biology was pending, with 7 courses were pending. Now biology is going to be checked off. So really, again, this is saving you. Not only are we calculating your CASPA GPAs, but we're telling you how many courses you have left for each school you're applying to. Now for York, you'll see I have 6 pending. If I go to another, Tennessee, for example, I have 6 pending as well. Well, they almost probably have the same courses. Let me go to a different one. Let's go to Chapman. You see there's 11 pending on this. Now biology 1. So we're really helping you keep track of everything in this platform and saving you all that time of visiting all these schools' websites, manually keeping track of everything. And this is one of the biggest features I feel like of utilizing myPAbox. Same thing with the optional courses. If you've taken one of these, it'll automatically check it off and tell you you've met the requirement for it. So you don't have to go, researching have you met that requirement or not. Same thing with the conditions. Minimum grade of C is required. So if you have anything below that, it won't check it off. Following prerequisites must be completed before applying. Now for this school, for example, you need to at least complete these courses before you could apply. And guys, this is where it gets really tricky because every school, again, has a different requirement. Certain schools can accept online courses, other ones can't. Certain ones take your AP credits, others don't. So again, we've done all this hard legwork for you. In the healthcare hours, same thing. You could kind of compare your hours and see how many hours you have of the requirement. Same thing with evaluations. Now this one, you need at least 1 from a PA and MD, and it will tell you how many evaluators you have. We'll go over that section in a second. Same thing with the GRE, and you guys already can see where it's going. Now anything that's recommended, for example, Chapman recommends medical ethics and medical Spanish, it'll be broken down in a separate section. So you could still apply, but at least you need these requirements to apply. And and again, we would recommend that you at least try to do some of the recommended tasks as well. Grade section we already kind of went through, and again, we'll leave room some for questions if you guys have any. PA shadowing. Now, if you shadow a PA, this is where you're going to keep track of that. You're going to add the PA. So say, for example, if I shadow Jacob, you could input their email, his phone number. That's not his real number, so don't send him any messages on that or call him. Ortho, and say he was at Centers Orthopedics. And you save it. Now, once I start shadowing Jacob, or if I've already shadowed him, you could put in a single date as you're going along, or you could put a date range. So you could put the start date, say if you shadow him from here to, say, the 31st, and you could log in the hours. And this will keep track of all your total shadowing hours. Now, for example, if time comes for me to apply and I want to call him or I want to email him, that information you put here, you could click on these links and you'll be able to easily get access. You could email him, call him, like, hey, I need a letter of recommendation or whatever the case is. You'll be able to communicate with the PA that you shadowed through here as well, which again is important for when you put it into CASPA. Same thing with the healthcare hours, very similar. You put in your information here, the type of healthcare experience that you have, fill out that information, the start dates, as well as the supervisor information. Again, all this you guys will be putting into CASPA, so it's better to use that, early on, organize it. This way you have something to reference, when you're inputting all this information in. Now, Over here in the evaluation section, you could put in your evaluator, similar format to how you put in your shadow, the PA that you shadowed. Once you put that information in here, there's going to be certain, like for example, if you are getting 4-letter recommendations, there's going to be certain people that you are asking, some people that you've already asked, you've already submitted to CASPA. This is where you're going to keep track of it. So say for example, if somebody asked me to write an evaluation, you go over here, say if I agreed to it, but I didn't write it yet. So once I write it, once they submit it to CASPA, and then CASPA sends me the link to write the evaluation, you can change the status here. So this way you can keep track of where the statuses of where all your evaluations are. And once I write the evaluation and CASPA has received it, you can change it to that, and that way you know that everything is done for that evaluator. Same thing with the exams. You can add the GRE, the Casper. There's certain schools that will take the MCAT if you've taken it instead of the GRE. So if you're switching fields and doing that, you could put input in that. The platform automatically calculates it. Any international exams, and we're also going to be adding the PCAT in there for the next cycle. And really, guys, this is myPAbox. And I'm going to let Jacob speak a little bit if he wants. So if you want to switch.
Just
sit on. No, because you don't know if it's
Yeah.
Just sit over.
Hello, everybody. So Sergio brought up some good points, and obviously in speaking about the entire platform, but I just want to kind of paint a picture in certain scenarios. For instance, like PA shadowing or healthcare hours. A lot of people, or most people that are using myPAbox today, are probably ready to apply to PA school or use CASPA, and they already went through this process of creating an Excel sheet and trying to formulate all this information into one area or one Excel sheet or one notepad. And the problem with that maybe is if tomorrow it gets updated, something in one of those 5 to 10 schools that they are applying to gets updated, how are they going to know about it? They won't, unless they again do that legwork again. The way we've kind of structured this to be is this is the point of the report button on each school. So if you notice something, or all the users, and we have a substantial amount of users at this point that are using myPAbox, that allows everybody to be active. One of the key factors of making this a reliable source is the fact that it's interactive. Eventually, what we're going to be doing, and again, this is coming probably in the 2.0 version, is we're going to allow users to interact with themselves in the platform. Meaning, if you're applying to the same schools, there's going to be a chat created for people that want to apply for this particular school with the algorithm that we're going to have. So that's something to keep in mind. Again, the point of this is it's going to be interactive for everybody that's on it to use. Any updates, any errors that exist, for instance, or if a school went from continued to probational accreditation status, all these things can be manipulated by us within a matter of a minute or two from the time we're notified of this, or from the time that we notice it. I'll give you guys an example. If you go on a website, on any PA school website, and you notice yourself that there's a discrepancy between where they drop down all their prerequisites versus their frequently asked questions, they may be an error. And I've encountered that with 1 or 2 schools. I'm not going to mention their names, but it was interesting to notice that they didn't catch this mistake. And again, I understand it's made by humans, so we all make mistakes. But when I asked them to change it and I notified the directors of the programs, listen, this and this is wrong. One area of your website says one thing, the other says something else. It took them about 3 to 4 weeks to change it because of all the, I guess, bureaucracy and everything that they have to go through in order to change one simple sentence or one period on a website. In our case, it doesn't work like that. In our case, literally, you let us know what the update is, it's done within 5 to 10 minutes, if not sooner than that. It's that simple. Um, any questions that we're getting from there
Yeah,
so far?
so it's going to be. I had a question about the CPR certification. Mine expires in July of this year. Should I go ahead and retake it in April or May so I'm good for the next years, or wait until like it expires and retake?
So, if you're applying to schools that require uh, BLS or ACLS or what was it, the CPR,
Mhm.
you should retake it because if you're going to be applying, if it's going to expire at the time of your application,
Correct.
then you don't have the fulfilled requirement because when you send them the proof of verification that you took the course, it's going to give them a time frame and it's going to expire within the next cycle. So my recommendation is retake it. It's not that expensive to do it. It lasts for 2 years, and you'll have it throughout your God willing, you get accepted to the program, you'll have that certification during your program also. Because most schools are 24 to 28 months. That's
Yeah, and
the
some schools also
predominance.
give you the CPR certification like Toro did. And remember, we got ours during,
We got ours
yeah,
during,
during PA
but
school.
again, I don't know why PA schools want it prior because you're not seeing patients until your didactic year.
You mean clinical
Sorry,
year?
until your clinical year. All you're doing in your
Well,
first year is
first year, like for example, we did hospital visits as well. Remember, but you're really not seeing them on your
again, you're
own
not
like that.
seeing patients at that point, so I don't see the necessity. But again, some schools mandate it. Some schools mandate to have which is again surprising to me because I didn't even have this in PA school, is a cadaver lab prior to you getting like that's their prerequisite.
Yeah.
So I find that to be very very strange and like setting the bar really high because most PA programs don't give you a cadaver lab to even learn from in anatomy. But
Yeah. So,
any
but yeah,
other
the question is,
questions?
just retake it. Will you be able to see your CASPA GPA? Will you be able to see your CASPA calculated GPA before you submit your applications? If
So absolutely. So CASPA calculates their GPA in a particular format. If you guys go on CASPA and you want to see how they calculate their GPA, they give you the formula right there. They also give you an Excel sheet that you can download and then you can start manually typing in all your classes the way they describe for you to do so. Again, it takes a little bit of work. It's going to take you probably 30 minutes to 1 hour to type all of your classes in, and it'll give you the CASPA GPA. We already have that in our um, system, and it's right here. This is your regular college GPA, and this is your CASPA GPA. It is different. It depends on CASPA has its own unique way of calculating the GPA.
but once you submit your application, you will not know your CASPA GPA. You will again. What Jacob's saying is that you can do it on your own, like either through
Oh,
myPAbox or
they
through
asked
Excel
if
sheet.
does CASPA let you know what your GPA is?
Yeah, will you be able to
No,
see? You will not be able to see it. So it's
no.
better. It's that's where PA. You could do it through the Excel sheet that they have, or but
Manually, if you know the formula
yeah, or
yourself
use
and you want to
myPAbox.
reapply it, or yeah, use my PayBox.
Next question is: Can you
Next.
explain continued provisional and probation accreditation status? We're going to be doing a webinar on that, but Jacob, if you want to,
So the easiest way to I'm not gonna go in too much detail about it, but if a school is so let's go
yeah,
to the statuses, for instance. Like at still is continued.
click on that link.
So this link, if anybody wants to confirm what it is, we basically direct you to the ARC-PA, which is the accrediting body for all of PA programs in the country. Here, you'll be able to go over all the accreditation statuses and what they mean, and is it worth it for you to apply to those programs. So you have to decide. My recommendation is always try to apply to a continued accredited program because they already set a standard. They've met the standard, and if you pass everything, you'll get your degree from a certified program. If a program fails for whatever standards while you got into the program, some programs you're going to be taking a risk. And again, that depends on your situation. One thing that Sergio brought up earlier is that we had a live on tuition. Tuition for me is very important in terms of when you apply to PA school. Some folks want to apply to PA school just, hey, let me apply, whichever I get in, I'll deal with the loans of tuition when I finish through my work ethic. That's not a good plan. Most people still do that, but you're digging a big hole for yourself that you need to dig yourself out coming out of PA school. So my suggestion is think ahead 2, 3, 5 years. If you're trying to get into PA school and you're putting your efforts in, you will get in. The point is get into the school that you want to get into, not just a random school just because they accepted you. So that's my 2 cents on that.
Yeah. So the next question is, what type of direct patient care hours do most PAs would like to see on your application? So couple of like direct patient care hours. Like if you, and the other thing is most schools have it listed on their website as well. But like an EMT, nurse, paramedic, what are the other ones? CNAs,
Yeah.
stuff where you're really involved in the care of the patient. But for example, a lot of the question is like whether a scribe is considered direct patient care or not. Some schools will take it as patient care hours. Some schools, I don't know, might not take it. It's always good to verify with the school and confirm, so
Absolutely.
this way, you don't get a surprise later on in the end. Um, is there a way this is going to be saved? Yes, it's going to be on our YouTube channel, so you guys could watch it later. I'm applying for next cycle, but I have spoken with those who are completing my evaluations. I send it to them now, but since the new cycle begins in April, would it save for the next? There is an option of copying your information from the previous cycle to the next cycle, but I'm not 100% sure. We'll actually get back to you on that. We'll leave it in the comment once we verify it because I don't want to tell you the wrong information. Um, but I do believe some of the data does cross over, but we'll confirm for you and let you know. Um, I worked as a front desk receptionist for a few years. I understand that it isn't direct patient contact. I input it under indirect patient care hours in myPAbox. Do you know how it be added into CASPA? It would be added under indirect as well.
Absolutely.
Because the way that we kind of made myPAbox is to mirror what you have to do and input it later on into.
Yeah. So one of the examples that we're going to show you as what he means. So when you put anything into CASPA, you have to break it down. And some of the ways I'll tell you what do I mean by that in terms of the classes. If you notice, CASPA is going to ask you which category, which department that the class is taken in. We already went and did the legwork for you, and it's right over here. You understand? And this is basically the breakdown. As people give us, like for instance, add a course, and the course is not listed from our course list here. We add this in. As we're adding it in, it's added in the CASPA format, so it saves you time.
Yeah, and we'll kind of go on
Go on
CASPA right now,
CASPA and
so
we
this
can
way
show
you
you.
guys could quickly see that because that is a. No, I think it's CASPA. Liaison. I think that thing is saved.
No, this is not it.
No.
Actually, yes.
I forgot my password.
It's alright. We'll see if you remember his password here.
I doubt it.
Spam his email, guys.
No. All right. Well, we'll do it. We're gonna be doing a live on CASPA as well soon, like
No,
another
but-
webinar on it. But
Oh, where did I go?
but we'll kind of go over that as well. So next thing, what do you recommend as a good way to get in contact with PAs to shadow? Go ahead, Jacob.
So to shadow PAs, I think it depends on how outgoing you are. If you're persistent and you're going to be persistent in getting what you want, my ideal situation, go to any and every medical office around where you live or where you prefer shadowing and just approach the PAs, speak to the secretaries, approach the PAs. Most PAs are willing to allow people to shadow them because they also want to grow the profession. And they know that that's the only way you can get into PA school, at least most PA schools. So be adamant about it. Go to every place and ask. If you go to 10 places, even if one of them tells you, okay, you can shadow me, perfect, you reached your goal. You don't need all 10 places to say yes to you. You need one of them to say yes to you. So do your work. Don't expect other people to do it for you. You want to get into PA school, it's tough, but it's worth it, and you have to put in your legwork into it. So a lot of people have an issue with PA shadowing, and I never understand why. It's simple. Just go out there and speak to medical providers, and they will let you shadow them. Period.
And another big thing is go to the PA forum, go on Facebook groups. There's a lot. Say if you can't find, say if you live in a place where there are not that many medical providers there, or you might not know anyone, and that could be tough sometimes. Like for example, where I'm working, they're really looking into whether they're going to allow someone to shadow or not. So even some of my friends who want to apply to PA school, I'm telling them, hey, you can't shadow right now. So, but there are places that will allow you to do it and PAs that will allow you to do it. Put it on the forum, go to Facebook groups, even if you have to go travel to a different state, get a hotel because if say one of your schools requires that you do PA shadowing and you really are having a hard time in your state, put it on Facebook group and see if a PA will allow you to shadow for a day or two, and you could put in 15, 20 hours and get a hotel room. Where there's a will, like what Jacob is saying, where there's a will, there's a way. And again, it's tough sometimes, but get creative. First see what is local. If you can't find anything local, go on social media, stepwise. Everything should be stepwise, right? So
Absolutely.
next question is.
I think that's it.
I'm sorry, an MD requested that I send it to them now, so would it roll over for the next cycle? Again, we'll get back to you. My CNA certification course was 10 credits class at a community college. Even if this wasn't part of my bachelor's degree at my 4-year university, do you think CASPA would include this in my GPA? Even if this wasn't part of my bachelor's degree at my 4-year.
Yeah. Any classes you take in any high school you have to put into CASPA. They consider
or certification. It was a certification. So certification might be different because if you've taken
certification,
that's going to go into the certification section of CASPA. That's separate. If this is not concluded in your GPA, then they will.
Well, no, they're not going to calculate this in her GPA.
Yeah, this would be
from
under
that perspective. Yeah. If you took a specific course required for a particular school, that they will count. But this is if you got a certificate that has certain courses within it, they're not gonna. I don't think they will
calculate that into that.
Yeah, calculate that.
But CASPA has a very good customer service. Give them a call and confirm. As far as how they're going to do that.
Yeah, for sure. Okay.
So I think those are the questions, and
we'll be concluding our first YouTube webinar, and we'll probably be doing this on a monthly basis with different topics, and hope to see you guys in the other videos. So good luck on the application cycle. If you have any other questions, you guys can always follow us on Instagram, DM us, or follow us on Facebook and send us messages, whatever it is. We're very responsive. Again, we're trying to help grow this profession, and the first thing that we can do is help more people get into PA school in order to grow this profession. So good luck again, and hope to see you guys in the next webinar. Be well.